welcome everyone. Thank you all for being here for our August webinar, which is brought to you through the partnership with the North Carolina Medical Society and the North Carolina Medical Group Managers. So thank you to them for their partnership and for helping with us today. And I am going to try to keep everybody on mute throughout the presentation, or ask you to stay on mute throughout the presentation. And you can add questions into the chat feature or use the raise the hand feature at the end. Will allow enough time for questions. And if any questions are not answered or they are not able to get to them today, then we can provide a follow-up outside of the webinar or after this. I can send that out. The webinar is going to be recorded and I'll make it available in a couple of days. It'll be on our website, and then it may be on the Medical Group Manager's website or blog as well. So today's webinar is Strengthening the Payer-Provider Partnership from Onboarding to the Point of Care with Blue Cross Blue Shield of North Carolina. And our presenters today are Ms. Linda McMillan, who's the Director of Blue Cross Blue Shield North Carolina Provider Data Management, Carrie Spoonar, Principal Strategic Advisor with Provider Data Management, and Daniel Zajac, the Senior Business Systems Analyst with the Provider Data Management with Blue Cross Blue Shield. So without further ado, I will pass it on over to you, Linda.
Awesome. Thanks so much, Kristen. So let me get us going here. By advancing slides, if I can figure out how to do that. So I just want to say good afternoon. You know, my name is Linda McMillan, and I do have the oversight of the PDM team at Blue Cross North Carolina. Before I get started, I want to acknowledge, though, the North Carolina Medical Society and MGMA for sponsoring this webinar and affording us the opportunity to meet with you today. Both the Medical Society and MGMA are relentless advocates and warriors when it comes to their members, and we look forward to working more closely with not only you, but also all of the provider groups and provider partners out there. And it's really important for us as well that, you know, we're all in this together, and keeping healthcare local is good. We like that. So as far as the agenda goes, so today my colleagues and I will be giving you an overview of our onboarding processes, including bottlenecks, guidance on maximizing efficiency in the process. We're also going to share our provider program, which is kicking off in 2023. That's an investment in our capabilities and will improve your onboarding experience. Carrie will be talking more on this. And then Danny will be sharing with you an exciting new program that will be launched this year as a demonstration project, and we're coining it Connected Care, that leverages a simple technology platform that delivers real near-time, I mean, like within a couple of hours, ADTs into the practice workflows. An ADT is admit, discharge, transfer into the workflow, and also providing education, learning support through the learning collaborative approach at no cost to participating providers. And then lastly, I'm going to update you on some recent legislative updates that you probably are aware of, but I'm just gonna share more information on where we're at with that as well. So thank you, everyone. And I'll go ahead and launch into to this. So first things first, Blue Cross North Carolina, we have a lot to learn from you. We know we can do better, and we will do better. What I see when as we look at this slide, is I see a common theme here is trust. And, you know, I think for me, once trust is lost or diminished, it requires an extra large effort to regain it. And so the way that we can regain this trust is by showing that we hear you, we understand the issues, and we will make change happen fast. You know, I think about this and the way that I like to lead my team also is about communication, transparency, and collaboration. So for me, it's all about that. It's all about knowing what's going on so that, you know, you can anticipate whatever reactions might be anticipated. But it is about a healthy relationship, a healthy partnership. And so to win, we need to be in it together. We have some ideas for moving this forward, and Carrie's going to speak with you on this in a little bit. But I also think it's important to hear from you. So as we roll out new things, we want to make sure that you're included and that you understand what it is, how it impacts, you know, what you're doing in your own offices day to day. You know, the most fundamental part of our relationship is in the very beginning, the onboarding process. So, and that experience that can be very painful. We know it. Believe me when I say that inefficiencies in this space are felt not only by you, but also by the provider team that supports you and your patients waiting to be able to have access to care. So, you know, the high inventory levels, the inefficient processes, it really impacts the team as well. You know, we have low morale, as well as we know that we're creating frustration. So we want to address these things today. And, you know, we want to make it right so that we're asking to partner with you as we build this future state. So our onboarding process, this is a very high level. I will talk a little bit about this, but our onboarding process needs to be completely overhauled. It has not been overhauled, I think, forever. I think, you know, it's always been this way. And I hear that a lot. This is how it's always been. So for most providers, the onboarding process makes the start of our relationship, our partnership. And oftentimes the process is long and costly for everyone involved. I mean, it impacts all of us. A simple oversight on the enrollment application can cause major delays and frustrations for both you and us, as well as unclear directions on the process can also create abrasion. So today I want to give you some insight into our current onboarding processes, including some common bottlenecks that we have, and offer some recommendations on how you can navigate those, and also how just being aware of what the process is, I think will help you understand a little bit as we start to re-engineer the whole end-to-end process. I recognize that we have an abundance of inefficiencies, but I also want you to know that we're committed to improving this process with your help and ultimately improve the provider experience and build back trust or build trust. So as you can see from this diagram, we have a lot of bottlenecks. When a provider onboards, there's a lot of steps that happen, and it's not clear, I think, to you that certain things have to happen before certain other things can take place. For example, you have to do the Blue E and EFT before a contract can even be created. You have to go through a credentialing first before anything happens. Then once credentialing happens, it goes to enrollment to set up a shell record, then goes back to contracting, then to pricing, then back to enrollment, then to contracting. So there's a lot going on here that needs to be streamlined. What we're talking about that's happening is sequential processing. We need to be doing parallel processing. So if you want a contract, that contract should be being built while the credentialing is going on, while the enrollment is being set up, so that everything is happening in an end-to-end that has a defined time frame of less than 60 days from beginning to end. When you add up all of the times that each area has to perform certain pieces of the enrollment process, you stack those all together and that equals 140 days. That is not acceptable. What we have to do is we have to unwind that, redo it, and make it so that we're doing things in parallel and at a much quicker rate of turnaround, because we realize that patients are waiting to be seen, providers are waiting to be able to bill. You know, there's just a lot going on here. So having that commitment of a end-to-end process that gets you where you need to be within 60 days, I think is putting us right there in the target zone. I think we can do better than 60 days, but I want to commit to 60 days to begin with. So let me talk a little bit about some of the big bottlenecks we have. We have multiple bottlenecks. We get about 200 intakes every day that come into an email box. The email box, everything comes into it. And I think, because the process isn't clear and simple, you've got credentialing requests, enrollment requests, demographic change requests, contracting requests, all coming into the same email box. They all have to be triaged. And then they get triaged and put into an inventory queue. We have about 24 inventory queues because we also have 2 different teams working 2 different lines of business. So if you are looking to enroll a provider in commercial and senior market, that's 2 separate teams that work that, 2 separate databases that hold the information. And, so those processes aren't standardized. We need to, what we're doing in 2022 is we are standardizing our processes. We're creating a single source record so that, we don't have a separate, a separate data store for senior market and the separate one for commercial. That's one of the very first fundamental foundational things that we're doing. And we actually started working on it last year. So that'll be really great when we get a single provider domain that will allow us to reduce our inventory queues. It will allow us to process a provider succinctly one time with one team rather than how it is today. So lots of changes coming in this space. And I'll talk a little bit more about that too. But one thing I wanted to point out here is the one team working together is really what can you do and what can we do so that we're being transparent, we're communicating, and we're collaborating. First thing we need you to do is fill out the forms completely, make sure you read everything carefully, make sure that you're sending us the attachments that are required. Communicate in advance when you know a buyout is going to happen, let us know in advance. That will help us a lot because what happens is we don't so often, not all the times, but we find out that a buyout has happened through the back door, right? And then kind of putting 2 and 2 together. But that causes abrasion because we didn't treat it as a buyout. We treated it as this group termed, and now we're adding a new group. It created letters that went out to members, just a mess. So I think communication is really key here. Providing current contact information. Make sure we have a good email address so that we can get in touch with you. We don't want to use snail mail, and I don't think we're using faxes that much anymore. Be adaptable to the new processes and automated tools that we're going to be rolling out. And that's where I think we can work together also so that we're transparent with you and what's coming, what's coming. We can get your feedback also to say, and you might say, oh, what, that doesn't make sense. Can you, maybe change it to this? Yes, we want to hear that from you. And just following the onboarding processes. But that said, I think Blue Cross, we need to do a better job of making sure that the instructions are clear and simple, that you know where to go to find the onboarding processes. Right now we have just redesigned our enrollment form, which I don't think has been redesigned in years and years and years. And we're making it so that it's digitized. We still can't consume it yet, but it's going to be. So right now we get enrollment forms where people are writing in the margins and giving us little notes here on what this means and what that means. And, if you look at our enrollment form, I can see why people are writing in the margins because it's not a clear and simple form. So that's going to be coming out very soon. It's been finalized. We would like to share it. And we'll talk to Kristen and how we can get this out so that you have a sneak peek before we go live with it. I think that's really important. So us working together to maximize onboarding efficiency, I think will clear a lot of confusion while we work together to create a better process end to end for all of us. So I wanted to comment on some questions that have been coming through. So some common questions the PDM team typically gets from providers are what you're seeing here, and I've got some others listed that came in when this meeting invite came out. When do you get an acceptable turnaround time for onboarding? Great question. Onboarding, like I said, if we're following everything to the T, it goes through all those different areas, it's 140 days. That's not acceptable. And that would be a brand new onboarding. Even linking a provider to a group takes forever because it gets caught up in that bottleneck of getting that email into that huge email box where we're getting 300 a day. It has to be triaged. You know, we have so many days to triage, and it puts timelines. It creates abrasion. So one of the things that we're doing for that kind of onboarding is we're building automation. And I'll talk to you about that in a minute when I talk about some of you know, the other things coming down the pike. But automation for the maintenance form will be key. We have not updated our maintenance form or the demographic change form. That is on our list to do. What is the current provider enrollment backlog? Well, we were in a horrendous backlog, as you know, at the beginning of the year. It was horrible. And, you know, there's a lot of reasons for that. The amount of intakes that were coming in, we had a lot of staff turnover with the COVID. We had a lot of, you know, processes that trumped other processes because of COVID. But I think we're stabilizing now. And I think we're getting back to a enrollment timeframe that is within, you know, our norms, but our norms are not good. So we're going to change that. So what is the current provider backlog? I think that's the question. It's we're right now at 60 days. So at the beginning of the year, we were at 120. I think we might have been a little bit more than that, which I don't even want to say out loud. But we've gotten much, much better. We've had to hire a lot of new people. The training for hiring folks takes a long time. It takes several months to get somebody new onboarded, and that's because the onboarding is so manual, so cumbersome, so much goes into that. And that's part of also what we're going to be changing. Will internal errors and system updates be addressed for a smoother process? Yes, that is an absolute yes. So we want to make the process smoother. When will the website portal and manual be updated? That's a great question. I think that we don't update our manual nearly enough or timely as we should. I think it's every year or two. I think it should be updated whenever there's a change. We should go in and we should update that. The Blue E portal gives you kind of information, but we are looking at building out an actual enrollment portal, you know, just for enrollment purposes, not having to go through Blue E to launch your enrollment work. So there's a lot coming. Some of the other questions that came in, I want to just quickly address is what options exist for solo and small practices. It's all going to be part of the same. We're going to all work together. We want to utilize CAQH for credentialing and recredentialing. We'll start communicating what that looks like. We really want to get rid of the DOI form and just use the CAQH form. Let's see, what other questions came up? Why our CRNAs should be linked to a group. There's no reason they should not. If you're having problems with that, please reach out because I need to understand what's going on there. What's taking so long to add credentialed providers? I want to just delineate the difference between credentialing and enrolling. So credentialing is one of the first things that happens in that diagram that I showed you. And that actually is quite timely. We get that done, you know, within the window of 60 days. Usually it's within 30 days on an initial. It's all the other processes that are tripping us up. You know, it's the back and forth with the enrollment and the contracting and all of that, all the other pieces that come in. So there is a difference between credentialing and all the other pieces that have to happen to get the provider set up. So I just wanted to, address some of these questions, and we'll, the ones that aren't addressed, I'll make sure to get you answers after this meeting and after doing a little bit more research. Okay, so I do want to share with you, and you're probably all familiar with the CAA, the Consolidated Appropriations Act, which is federal legislation that went into effect at the beginning of this year. And for us, our piece of it is the directory mandate, which stipulates that providers will attest to their data every 90 days. And if they do not, those locations information is suppressed from the directory until attestation happens. We are not turning this on until we're ready to turn this on, and we have everything in place so that when you give us an update, that update is made in 2 days so that we can address your attestation requirements by ensuring that within 2 days, our directories are updated. That's part of the automation that we're building right now. It's going to be a full automation, not just limited to these few fields, but that's what we need to have in place before we actually say, we're holding you accountable to this. We will keep you in the loop. We will keep you apprised as to how things are moving there and how you can meet this mandate. We want to meet you where you are. So if you use CAQH, we want you to continue to use CAQH. We want to build out our change form so that we can ingest that through automation. So it's updated within, 2 days. We also are partnering with Quest Better Doctor. So that's another portal option for you to go in and attest. So we're going to keep you in the loop on this. We want to work together with you. And yeah, so there's more to come there. There's a lot of work still that we have to do here before we can roll it out to you, but we will keep you updated regularly on this. So next, I want to turn it over to Carrie, and she's going to talk about building bridges to drive change. So thanks. And I'm going to stop sharing, Carrie. Okay.
Thank you, Linda.
You're welcome.
And I trust everyone can see the screen. All right. All right, good afternoon. My name is Carrie Spanar, and Strategic Advisor for the new Provider Partnership Program. Provider Partnerships is a foundation program that was recently formed in May of this year. And the purpose of the program is to, number one, modernize the onboarding process to decrease provider administrative and financial burden and improve the overall provider onboarding experience. So Linda touched on that quite a bit. Obviously, there's many opportunities to improve the process, and this program is really setting the stage, the foundation for making that happen. Two, the second purpose of the program is really to empower providers with the tools, processes, and support to improve care outcomes and expand practice capabilities that are really helpful in accelerating transition to value-based care. The program represents a significant paradigm shift and really is attesting to Blue Cross's commitment to strengthening its partnership with the provider community. So currently, the Provider Partnership Program consists of 10 distinctive initiatives. Some of the key initiatives include self-service portal, provider portal for onboarding. So this is not the Blue E portal. It's a completely separate portal dedicated to the onboarding process. And some of the key features that we're hoping to include in this is automated onboarding process and status updates. So you can actually get into the portal and see where the status is on your application. Ultimately, these improvements will decrease the backlog, reduce errors, and be less time and labor intensive for you. Another key initiative is a single enrollment process for the senior market and commercial onboarding. As Linda alluded to, currently we have different enrollment processes for these product lines, and that creates a lot of inefficiencies for both you and Blue Cross. And we're going to eliminate the back and forth that everyone experiences in enrolling in these different these product lines. And there's going to be one streamlined process for all product lines, which will ultimately save time and reduce errors. Another key initiative is a single workflow solution for enrollment, pricing, contracting, and so forth. Currently, you have to open many doors to complete the onboarding process: enrollment, pricing, contracting. The onus has really been put on the provider to really open those doors. This particular initiative will streamline the process, so you only have to go through one door, saving you time, effort, and gets you enrolled a whole lot faster. Another initiative to look forward to is the integration of third-party data sources for the directory. And I think Linda just alluded to that with the No Surprises Act. But our directory right now has the bare minimum for practice details. And so what we're hoping to do in this initiative is create a much more user-friendly directory that includes more practice information on your services, your address, your hours, your hospital affiliations, if you offer behavioral health services, what type of services, and more. It's just going to be a much improved user-friendly directory that's really going to help patients find the right services at the right time a whole lot faster. So the aim of the provider partnership program is really to meet you where you are. In doing so, it's our goal to create a much more improved and responsive onboarding experience for you so you can focus on what you do best, which is taking care of patients. This particular slide highlights some of the experiences that we're hoping to create for you as we modernize this and create a much more improved onboarding experience. With your help, we want to create a credentialing and onboarding process that is fast, easy, and standardized to make sure you can bill and drive practice revenue. In terms of eligibility, cost, and coverage, you should expect to quickly, efficiently, and accurately verify eligibility and benefits in real time, heading off any issues that can potentially complicate the process and set up a positive patient experience from the get-go. In terms of getting paid, coding, and claims billing, we should pay exactly what you're owed and do it on a timely basis. So I think, again, Linda alluded to, we acknowledge we have a long way to go to enhance the onboarding experience for you. I think you've got a pretty dedicated team in the provider data management area at Blue Cross that's pretty dedicated to making things happen and making it easier for you. Through the Provider Partnerships Program, we have the opportunity to work together to really reimagine the onboarding process for you and make essential improvements while helping you deliver the best care possible to your patients. So as we move forward with the Provider Partnerships Program, your voice is vital to our ability to redesign this onboarding process to meet your needs. Without your insights, we are blind to the many slivers of opportunities that can be improved in the process. So we're interested in working closely with about 7 to 10 providers who are willing to meet quarterly with us to discuss any pain points, offer feedback, review enhancements, advise on communication and engagement strategies. This is really an opportunity. It's not supposed to be a heavy lift. It is really just a lot of listening and solutioning and talking about ideas. I think that, whenever you redesign processes, you've got to work. I mean, it's important to work with the people who are closest to it, and that's you, our provider community. So if you want to be at the table from the start and look at everything end to end, please consider joining our work group and be an advocate for the entire provider community and help us get to where we need to be so that we can help you do what you need to be doing first, which is taking care of the patients. So there's another project under the Provider Partnerships Program that I'd like to talk to you. Well, actually, I'd like to introduce to you, and Danny Zajac is going to come in and explain a little bit more. This is a very exciting project. And Danny, I'm going to let you take us from here.
Alrighty, thank you so much, Carrie. Just setting up the screen share. So if you can let me know if the PowerPoint is showing up, that'd be appreciated. I think it's
yep,
okay.
We see it.
Appreciate it. So good afternoon, everyone. My name is Danny Zajac. I'm a member of Linda and Carrie's team here at Blue Cross North Carolina. I want to thank you all for the opportunity to speak with you today and introduce the Care Transitions Collaborative. Before I get started, I also want to thank North Carolina Medical Society as well. So this is a program that we are offering, at least to kick off at no cost to the provider community. And really the goal of this initiative is to establish stronger provider partnerships and as an extension to improve the transition of care for the patient community of North Carolina. And the way that we're going to target accomplishing that goal is to engage and educate providers in a way to empower them to take advantage of a tool and a training and educational opportunity partnership that will allow the provider community to enhance the way their practices perform as it relates to transition to care efforts. We're going to do that through a virtual health and patient engagement mobile app and pair that with a group that we'll get into a little more detail here later that will provide education and learning opportunities for the participating practices. So the next couple slides are going to cover the what, the why, and the how. In terms of the what, there's been a lot of success across the country with groups that have been able to find ways to incorporate clinical health information exchange data into their daily workflows. So that represents electronic receipt of admission, discharge, and transfer notifications and discharge summaries. And the goal of that streamlined connectivity through a health information network is to bring this data to the provider and to the care team in a streamlined fashion and reduce the burden associated with coordinating follow-up care. And an extension to that is that this needs to be timely. So near real-time data or information transfer from the health system to the provider to ensure that you're reaching out to the patient in a timely manner, and not only to provide good quality care, but also to be sure that you're taking advantage of the measure specification as it relates to HEDIS and STARS, how that impacts your performance, and also your reimbursement. This is just a quick data flow for those individuals that are interested in or learn in this type of way. But essentially what the Practice Transformation Institute will be supporting the care team in is developing processes to incorporate this workflow through the mobile app Care Convene. So essentially, as the patient is discharged either from inpatient or emergency room, that health system will send that notification to North Carolina Health Information Exchange. That will then be made available within Care Convene, which will provide an alert to the provider and the care team. And that's what kicks off the steps to initiate the transition to care outreach, to schedule a patient follow-up appointment, to review the discharge information that occurred during the encounter, and process that patient through your practice to perform medication reconciliation. So as far as the solutions that we're going to provide, as I mentioned earlier, the first one is Care Convene. So this is a virtual health platform that provides real-time admission, discharge, and transfer notification at the point of care to providers. And that's paired in a virtual care setting. So I want to make a distinction here between telemedicine and virtual health. Telemedicine is pretty simplistic form of communication, reaching out to the patient. Virtual health has some more broad applications in terms of phone call or text functionalities, or even face-to-face video calls, and also incorporates clinical data. So there's a lot more power in the hand of the care team with the virtual health platform that we're looking to introduce to the participating practices. And really, again, it's to help facilitate the transition of care efforts and leverage an HIE model to streamline this process. The goal is to improve the coordination, and this is available through different functionalities within the application. There's different outreach campaigns. One of the features that is very popular among the provider community, the text-to-visit functionality. So as you get the notification as a care team member and decide who's going to take action on that, you can actually reach out to the patient via text and set up either a chat feature for follow-up care or even a patient video. And I think one of the things that we're trying to accomplish here, which has been successful in other states, this day and age, what do we want as not only patients but in general as consumers? For the most part, it's convenient. So we're all busy, we're all running around taking kids to practice or going to different appointments outside of work. Maybe you have a lunch break at work, but you can't get to the doctor's office. This provides that opportunity to, as a provider or practice, to engage with your patient and offer some convenience both on your side, but also on their side. Try to fit this in, these transition of care processes in an innovative way, just to take the next step forward in this healthcare landscape. To learn how to do that and take advantage of what the tool offers, we're also introducing the Practice Transformation Institute. Really, their whole mission is to empower physicians and the rest of the healthcare professionals as part of the care team. And they do that through different training and learning opportunities, and learning how to apply integrating the clinical and administrative data into their daily workflows. So while we're trying to collaborate with the participating practices, we also want to identify and make you aware that there's beyond the value of improving processes and improving the patient care and adding a different puzzle piece to what you already have established. This effort does come along with medical education and continuing medical education credit. So there's additional value with your time going into these trainings and learning opportunities. And really what that looks like is practice coaching, implementing the chronic care model, getting feedback from the participating practices and how to improve this process, learning different strategies that have been successful at different levels of age range in the population for patient engagement, incorporating that into TLC workflows. And then ultimately, though, primary focus number one is to improve patient care, learning all these things together helps you conceptualize the different opportunities for revenue streams to make this effort worthwhile financially as well. And then just real quick to tie this all together in terms of enhancing workflows. So what makes this all possible is the model of a health information exchange or a health information network. When these were introduced a handful of years ago, it started to introduce the concept of getting away from individual connections between providers and health systems, eliminating the need for duplicative charges for connectivity, duplicative maintenance, and really creating a better platform for data exchange security, both from a provider perspective, but also for patients. So this really starts and is made available through the hub and spoke model of a health information exchange. We will be leveraging the data from North Carolina Health Information Exchange, applying that to the CareConvene platform. And what those two primary data elements are, the admission, discharge, and transfer notification, and then the continuity of care document, also known as a discharge summary. So real quick, just going to cover those two at a very high level if you're not familiar with these, but essentially the ADT is very basic information. It's the alert or the ping that your patient presented at a hospital. There's plenty of data on the back end, but what CareConvene does is they present a very nice user-friendly application to allow the care team to use this tool to their advantage. So there's different ADT types, whether you want to focus on admissions or if you prefer to focus on discharge, you can make that selection. And then in turn, there's different ADT classes. So inpatient or emergency, you can certainly filter that information as well. Aside from that, you have, where the patient was seen, who saw them, when they were discharged, what the diagnoses were, or the problems that occurred during the encounter. And what's really nice here, as I mentioned on a couple slides previously, right within the same screen, you are able to initiate that outreach to the patient, kick off your transition to care. And that really is one of those things that we're trying to collaborate with the providers on, just to improve the process involved for engaging the patient post-discharge. And then I'm not going to read through all these, but just wanted to display this. If anyone is interested, the link is located on the bottom of this slide and the next slide. These are the mandated data elements that EHR vendors have to make available within their platform. The one distinction that I want to make is it's encounter dependent. So you're not going to get data for every single one of these categories simply based on what took place during the encounter. But for the scope of this effort and project, a handful of these categories would be important. The one I would point out here would be medication. So reaching out to the patient, scheduling the follow-up visit, you access the discharge summary, and you look for the medications that were prescribed at discharge, and you utilize those for your post-discharge medication reconciliation. The other items that are also contained within the discharge summary that certainly will be valuable: patient demographic information. You can also see some of the problems that took place and the procedures that were performed during the encounter as well. So this is really to be viewed as more comprehensive than the ADT, which is just a notification. This is kind of your additional information that comes over electronically. So you don't have to rely on the patient bringing it in. You don't have to get a fax. You don't have to reach out to the health system, try to track that down. This is supposed to be as streamlined as possible. So that's essentially the program. Again, I want to thank you for your time. We will hopefully we have enough time for questions, but I'm going to turn this back over to Linda to kind of try to reiterate the point of our effort and our goal to improve the process for our provider community, from onboarding to the point of care. So Linda, I'll let you take it over.
Thanks, Danny. Thank you very much. Thank you, Carrie, as well. And I want to thank everybody here for attending today, because I think it's really super important that we have this partnership and that you understand what it is we're trying to do to re-engage, build trust, and be part of the community, and keeping it local. So I think, understanding that we have a lot of work to do on our end-to-end and getting this work group set up. I saw a couple comments come through the chat that there's some folks that are wanting to participate. Thank you for that. I'm very excited. I think our 2023 program that is taking, we're ideating around that, but it's going to change the entire way that we onboard and that we do business with you. So we're very excited about that as well. The demonstration project that Danny alluded to is a small demonstration project. As he said, this is working in other states. It's very popular, and it's relevant because it does introduce a new way to learn how to, it's about practice transformation, right? And how we are looking at opportunities to bring the patient in when there's been an encounter and just really provide that better transition of care. So there's a lot going on here. I know we covered a lot today, and we're really open to your feedback, what you're thinking, how we can better work together, because that is our commitment to you. And I just want to say thank you again for everybody signing up and being on this call. Thank you. So, Kristen, I think I'll turn it over for closing remarks. Thanks.
Yes. Thank you all so much. And I didn't know if I know since you mentioned we do have a couple of questions in here.
Yeah, I'm seeing those right now.
Yeah, so the first one, are we being held to submitting until 30 days prior to arrival of the physician provider to be credentialed?
So we need to look at that whole process. I don't understand to only submitting till 30. I'm not certain that I am really familiar with that process and why, what that means and why we have it. So let me take that back. The second one, if a new provider with an existing group does not yet have a Medicare ID and we submit the enrollment application without it. So what we've been doing in this instance is we're processing the commercial side, but we're getting everything, in place for the Medicare side, but we have to have that Medicare ID before we can actually finalize it. So we can work out how that looks. My suggestion would be try to get that as soon as possible. Once you know you're going to be onboarding a provider, try to get that paperwork going. Because as long as, if you've got the paperwork in, I think, we can talk through that. And then, so there's a couple requests for the work group. We'll be reaching out to you for that. Awesome. And then I would like to know more about participating in the project. Is this the demonstration project? If so, we will get with you on that.
All right, and we did have a question too that came up, and I think there had been a question about this in some of the questions that were submitted, but just about the prior authorizations, and
Yep.
Or where are you all kind of on the unnecessary prior authorizations or that process and cleaning that up
Yeah, thanks, Kristen. And there was a few questions that were pre-questions that came out asking similar on that similar topic. So let me get with the right people that can speak to this, and we will put it on our parking lot. Well, not parking lot. We'll put it on our roadmap to make sure that you get some feedback, and also so that you're aware of what's going on in the Blue E space, because there's some revamping of that as well. So I think you need to be looped in on what's going on there so that we're all in the loop, because remember, it's about communication, transparency, and collaboration. That's my motto. So whatever we can do to help with that, we're going to do that.
all right. Can you all see that screen too?
Yep.
With
Thank
your
you.
contact. Okay.
Yeah.
And there were a couple of others as far as building trust and working together. Is Blue Cross looking to expand this to claims, benefit verification, and Blue E real-time updates?
Yes, I mean, absolutely. I think it's important. So yeah, I will be an advocate for making sure this gets in front of the right people and it doesn't get buried, that it's right there. Yep.
And does Blue Cross Blue Shield assist with Healthy Blue?
That's our Medicaid. Well, that is a carve out. So we use a different we use a different vendor for Healthy Blue. But if you've got some concerns, please pass them my way so I can make sure that we get them in front of the right folks so that they're addressed.
I can also speak to that. And if you have questions or issues after you've gone through Healthy Blue and maybe aren't able to connect with the right person, we do have a form on the Medical Society website too that you can send to me to help kind of connect to the right people, ideally. So there's also that, whatever works best for you all. And as far as the presentation, well, the PowerPoint, I mentioned at the beginning that we recorded this and it will be made available. Are we able to send out the presentation that you all did?
Yes, absolutely.
Okay, so I'll include that too and send out to the participants. Any other questions or comments that anybody has? And you guys should be able to come off mute if you have any.
Hi, I have a quick mention here. I'm floored at how many people have actually responded to show their interest in participating in the work group just during the presentation here today. So if you have even the slightest interest in participating and sharing your voice, please reach out to me as soon as you can, because we're trying to limit the size of the work group, and I think we're getting very close to that limit. So I encourage you to, if you have an interest, to send me an email. Thank you.
Awesome. That's great. Thanks, everyone. This is a really, I'm so glad that we were able to do this. Thank you, Kristen, for making it possible.
Absolutely. And thank you, everybody, for joining us today. If you think of any additional questions, you have the contact information. You can always send it to me as well. I just put that in the chat for everybody. And if there is not anything else from the participants or from our presenters, then we will call it a day. Well, or at least a meeting.
It's a wrap.
It's a wrap. There we go. All right. Well, thank you, everybody, very
Thanks.
much. Enjoy the rest of your Tuesday.
Thank you.
Thank you.